Just before, I'm going to talk to you about the APNA projects, particularly as we're heading home with these now. But I also wanted to say Liz Baldwin, who's one of our event coordinators, brought it to my attention last night. We actually have 200 new registrants for this conference. So 200 people that this is their first time. So welcome. And then we did a bit quick back of the envelope of how good it's going to be when you come back next year. So we'll look forward to seeing you then as well. So I was sitting and reading my notes this morning, watching the telly, and it's all sporting. So I've got a couple of sporting analogies for you. And I think, we've done our track work. We've kicked some really good goals, and now we're on the home run as our projects head towards completion at the end of June. We've had our eyes on the prize, and that prize is you, a better supported primary healthcare nursing workforce, and the even bigger picture, which is a better supported Australia through best practice primary healthcare nursing. So some of the challenges were to look at, we know that we're having, we needed to increase the capacity of the healthcare workforce, and it's critical to a strong and sustainable healthcare system, not just primary healthcare system, but to a healthcare system. And any truly well-functioning healthcare system has a good primary healthcare system. So we knew we had to increase the capacity of the workforce, hopefully increase numbers and their knowledge and knowledge base to help them build a sustainable healthcare system. Nurses are tertiary educated, they're regulated and trusted workforce, but at least 50% say that they are underutilised relative to skills and training. And with the current workforce shortages, expected to be about a 30% shortage across Australia by 2025, we really needed to think about how we were going to create a much more attractive workplace for nurses, and how do we retain nurses in primary healthcare. There are about 386,000 nurses nationally. There's about 13,000 in general practice, about 40,000 when you add primary healthcare nurses in community as well. And when you add aged care and other sectors, there's about 80,000 nurses in primary healthcare. We know that we are already asking you to do more, and we all know that nurses already want to do more. We know that evidence supports that nurse-delivered based care improves health outcomes and patient satisfaction and improves access to care. Our challenge has been to build awareness of how things can be done differently, to change care delivery and provide different opportunities so that nurses can work to their full scope of practice and be better recognised by their multidisciplinary teams. So what APNA did was we looked at what we thought needed to be done to actually create innovative models of care, increase the capacity and the profile of nurses and working in primary healthcare, and offer them professional and clinical support to transition into primary healthcare. It's about increasing, as I said, the profile of nurses, and then some of the projects we've done have diabetes clinics from Kununurra to wound management clinics in Melbourne. You've heard about a number of the clinics yesterday, but the programs that we had as part of the NiPHC were the Transition to Practice pilot, Career and Education Framework, the Enhanced Nurse Clinic projects, and the Chronic Disease Management workshops. So a little bit about each one of those. The Transition to Practice pilot, nurses need support to transition into general practice. As Robbie said, people often think, general practice, it's the easy way to go, or different fields in primary healthcare. You're not necessarily working, shift work. It's so easy for you. But it's actually quite a complicated and complex work setting. And we know that nurses transitioning into primary healthcare can feel isolated, unsupported in their new roles. Compared to the acute system, where there are formalised graduate programs, support and encouragement, there's not a lot of support in the areas of primary health care. And there's a lot we could and should be doing, and this has been the starting point for our transition to practice pilot. The transition pilot project helped to fast-track induction for nurses, and the program has helped over 50 new graduated and experienced acute care nurses transition into primary health care. The program includes professional mentoring, self-assessment activities and online learning, and are tailored to general practice and other primary health care settings. And what are the results? And we found that nurses are happier building their knowledge and their skills. And you can see there's a comment here from one of the nurses who said, "I don't think I would be a nurse if I didn't have the support from my mentor or access to the training modules that were identified in my assessment framework. I probably would be in Woolworths." One of the really important parts of all of the projects is actually the evaluation. And from this particular project, we have a 92% retention rate, which rates extremely well compared to other areas of nursing and transition programs. In August last year at the PICRIS conference, I had the very great pleasure of launching the Career and Education Framework. And from the time we launched it at 5 o'clock in the afternoon till 5 o'clock in the morning, it had already had 500 hits and been picked up internationally. So we're getting feedback internationally. We now know that there have been 10,000 nurses access this site. And it's an online tool. You can do it on your phone. If you haven't done it already, I think I implore you to actually access it and have a play. You can map out the type of things that you've done, and it helps you plan education direction that you may like to go. We wanted to have a framework that would improve the value or perceived value of primary health care roles, and we wanted to highlight a range of rewarding employment opportunities and career progression options available. The framework supports nurses to advance their careers within primary health by outlining the range of education, career development and progression opportunities. It's interactive. You can print out your report. If you wanted to use it as a tool to map where you're at, you wanted to, say, apply for another job, or you wanted to take some evidence back to your boss for maybe arguing for a pay rise, you can use the tool to help you build up your evidence portfolio so that when you go, you're armed with something more than just asking for a pay rise. You've been looking at tracking, I've done this, this, this and this activity, and here's where I think I am in my nursing career. And as I said, we've already had over 10,000 users. The enhanced clinic projects, we've had a lot of interest in. We're getting a lot of interest from PHNs. We've had a lot of interest from individual medical practices ringing APNA, wanting to know, how do I set up one of those clinics? What are the advantages of setting up one of these clinics? And the quote up there from the GP at the Bega Clinic, it works because it's nurse-led. The unique skills of the nurse, the ability of the nurses to help patients navigate the health system, and the fact that they are perceived by young people as more trustworthy with privacy issues and critical issues, critical to success. And I think we as nurses hear that from our older patients too, that they're trustworthy and they'll share information with us much more readily, and they feel much less intimidated possibly than when they're talking to the GP. As part of this project, we provided some seed funding to the participants to help them with time for planning, for implementing, and activities developing processes and resources, patient education and referral pathways, and clinical upskilling for the nurses in those practices. Both the transition to practice pilot and this particular project, the Enhanced Nurse Clinics, in the first round we were oversubscribed to about 4 or 5 times the number of spaces we had available. There are people on waiting lists who want to get into the clinics, and I think as part of the good news in the budget, we intend to ramp up both of these activities with our new funding. So I think the next couple of years is going to be really, really exciting. The chronic disease management workshops, again, we've had record numbers of people attending these workshops, and we know that education targeted towards nurses is highly valued and ultimately improves the capacity of the workforce. And if people, you hear talk about leadership, but to become a leader or to feel confident to do that, you need to actually have some knowledge. Knowledge helps you build competence. Competence helps you build confidence. And once you're confident, you then can lead. So the foundations that you would get from educational activities is just one building block in that pathway. We've had 868 attendees that attended 31 workshops that rolled out around the country. Some of the workshops in biggest areas, we had 100 nurses come along. We have a very high satisfaction rate for the education delivered, and over 90% satisfaction rate. And most people agreed, or strongly agreed, that the workshops were relevant to their workplace, have increased their knowledge and skills and their confidence, and provided value for time and money. So just in summary, we're seeing nurses are becoming more involved in care delivery, and we'd like to see nurses much more involved in actually coordinating and leading that care delivery. There are changing models of care that are relevant to their local populations, so nurses are very good at identifying the need and targeting the type of clinic, the type of activity that's needed in their area. These activities are helping shift to team-based care delivery where GPs and nurses and other team members are working together. Again, building confidence in care delivery, and I think a real focus on coordination and collaboration. I think it also helps increase role clarity and, most importantly, job satisfaction. Because if you can feel that you're armed to deliver a really good product and have kicking some goals, as I said, at the end of the day, it actually helps you make you feel good about your workplace, good about the job you're doing, and want to actually stay doing that. And I think one of the most important things is that move to a more autonomous practice for nurses. In the hospital system, we have nurse-run clinics. Very few people get to see a specialist in a tertiary clinic unless they've seen the nurse and they've been through the nurse-led clinic. And we just have to help push that thinking into the primary health sector. So, what are some of the next steps? We've been proud to deliver the NiPHC program over the past 2.5 years. We're delighted with the success to date, and it's important that government investment in the nursing workforce be sustained. It's expanding visibility and effectiveness of nurses within the primary health care is critical, and for a viable primary healthcare nursing workforce that's actually going to meet our population needs. There's still much work to be done, and as you're aware, we've submitted our budget proposal, and the finer details we'll let you know when we know a bit more. But I think the most important thing that there's been recognition that there are innovative models of care that are nurse-led, and that it's being recognised by the Department of Health, by governments, by other primary care organisations. And to go back to my sporting analogy, we've got the runs on the board, which is why we're being approved to actually go into that next round of activity. And this will be my last speaking gig for the day, I think. So I just wanted to just finish off by saying thank you to all of you. It's been wonderful sharing the activities over the last few days. The workshops have been amazing. The attendance has been amazing. And going back to the superhero and the Nurseforce, I think while everyone else is busy being a legend in their own lunchtime in our practices, nurses keep moving. They have that mass, they have the momentum, and they use their Nurseforce to actually get things done. So I think nurses are the superheroes. Thank you.